Dr. Smith, a renowned gastroenterologist, joins us today and asks, have you ever pondered over the typical causes of ulcers? Specifically, peptic ulcers that develop in the stomach and the upper segment of the small intestine. Today, we're going to delve into this subject with him. First on our list is an infection with a bacterium known as Helicobacter pylori. This pesky microorganism sets up shop in the stomach lining, causing inflammation and damage that can result in ulcers. Next, we have the regular use of non-steroidal anti-inflammatory drugs, or NSAIDs for short. These medications, such as ibuprofen and aspirin, can chip away at the protective mucus lining of the stomach, leaving it vulnerable to damage from stomach acid. Excessive alcohol consumption is another culprit. It can irritate and erode the mucus lining of your stomach, crank up acid production, and pave the way for ulcer formation. Closely related to alcohol is smoking. The nicotine from cigarettes can increase stomach acid production, reduce the production of bicarbonate that neutralizes stomach acid, and impair blood flow to the stomach lining. Then there's stress. While it's not a direct cause, it can make existing ulcers worse by increasing stomach acid production, often through stress-related behaviors like smoking or drinking alcohol. Genetic predisposition is another factor to consider. Some people are just more genetically susceptible to H. pylori infection and have less effective stomach lining protection mechanisms. Hyperacidity, or excessive stomach acid production, as seen in conditions like Zollinger-Ellison syndrome, can also lead to ulcers by overwhelming the stomach's defense mechanisms. Certain medications beyond NSAIDs, like corticosteroids and certain chemotherapy drugs, can increase the risk of ulcers by weakening the stomach's defenses or increasing acid production. Severe physical injury or trauma, radiation therapy, chronic diseases like Crohn's disease or ulcerative colitis, liver disease, advanced kidney disease, severe burns, viral infections, and autoimmune disorders can also lead to ulcers due to various mechanisms, such as inflammation, decreased blood flow, increased acid production, and direct damage to the stomach lining. Psychological disorders like bulimia or anorexia nervosa, complications from surgery or chemical exposure, and certain dietary factors, such as spicy foods and caffeine, may also play a role in ulcer development. In summary, ulcers can be caused by a variety of factors, ranging from bacterial infections and medication use to lifestyle habits and certain health conditions. It's important to remember that while these factors can increase the risk, they don't guarantee that an ulcer will develop. Each person's risk depends on a unique combination of these factors, along with their body's response to them.